My name is Catherine D'Ambrosio. Welcome to my blog on selecting a long-term nursing care facility for your elder. This particular entry addresses nursing care staffing ratios. When interviewing a facility regarding placement of your elder, I encourage you to speak directly with the director of nursing rather than with the marketing representative for the facility. And always keep in mind why you're considering placing your elder in a skilled nursing care facility. That it's not about the awards that are posted on the wall. It's not about the gourmet chef. It's not about a sumptuous lobby decor. You're placing your elder or relocating your elder from their home to a skilled nursing care facility for the provision of nursing care. So looking at the staffing ratios is a very important component that I want you to consider. When you ask a facility about their nursing care staffing ratios, you need to be able to cut through any attempts to disguise their actual staffing ratios, because the staffing ratio is not the number of nurses that are employed by the facility divided by the number of patients in the facility, but the number of patient care nurses in direct relation to the number of patients. So a lot of facilities employ nurses as administrators, as managers. A lot of facilities employ nurses to work part-time or per diem on call. And many facilities employ nurses who don't provide any patient care and don't do any administrative or management functions, but are employed for the sole purpose of filling out paperwork for reimbursement from nursing, from Medicare, Medicaid, and insurance companies. So you want to make sure that you find out what the staffing ratios are for patient care. And the staffing ratios will be different from one unit to another, so you want to make sure that you're getting the staffing ratios for the chronic care units and not for the Medicare or rehabilitation units. You want to make sure that you know the differences between the staffing ratio on day, evening, and night, that the day ratio will be higher than the evening higher than night, and the weekend ratios are generally a bit lower than the weekday ratios. You need to know that many states do not stipulate minimum staffing ratios. So I've been in many facilities where an RN has as many as 90 patients, that's 90, and each LPN might be passing medications on up to 50 patients, and each nursing assistant might be caring for 10 to 15 patients on day shift. These are unacceptable staffing ratios, because there is no way you can, even if you have 10 nursing assistants working for you, there's no way you can even see all of your patients and find out what their nursing care needs are for the shift, much less address each patient's individual nursing care needs, because the acuity levels in skilled nursing care facilities are getting higher all the time. Talk to the nurses directly. Ask them, how many patients do you have today? How many did you have yesterday? Is this normal? How many patients do you typically have? Ask them questions about, do you feel you're able to provide optimal care to each of your patients? And if not, why not? Speak directly with the nursing assistants. Ask them about the care that they provide and what they enjoy about their job and what they don't enjoy about their job. This will tell you a lot. And certainly a facility that wants to kind of barricade you from the nurses might have something to hide, justifiably. Let's see. And also inquire about the educational preparation of the nurses in the facility. So how many nurses are prepared with a master's degree how many master's prepared nurses do they employ at the facility? And if they don't employ any master's prepared nurses, how often are master's prepared nurses consulted with on nursing care issues in this facility? How often do master's prepared nurses provide in-services and training seminars to the nurses, and on what subjects? Inquire how many of the nurses have bachelor's degrees in nursing, and among those bachelor's prepared nurses, how many are certified in specialty areas such as gerontological nursing or wound, ostomy, and continence nursing? And how often do those continence nurses or wound care nurses or gerontological nurses, how often do they provide in-services and seminars to the other nurses and to the nursing assistants? How often are the nursing assistants offered education and training? Because remember, nursing assistants have about a 2-week education and training course on the provision of basic nursing care. They are not paid a lot of money. They are not given a tremendous amount of respect. So one way a facility can demonstrate that they value the care that the nursing assistants provide to your elder, particularly because you don't always have a lot of money to play with to pay people more. Of course, paying the nursing assistants more is certainly a way to show them that you value them, but another way is to provide education and training seminars. A facility that does not provide routine education and training for the nursing assistants is one that I would encourage you not to go to. So, I hope this has been helpful, and thanks for stopping by.